Surgeons at University Medical Center have performed a historic transplant surgery and the first living donor intestine transplant surgery in the southwestern United States.
What makes it special is that we did a living-related intestinal transplants, and only about 40 to 50 have been done worldwide. Most of them in the United States, either in Minneapolis or in Chicago, but not in the Southwest. Bowel transplants are right at the crossroads between solid organ transplant, kidney transplant, liver transplants, but also very similar to bone marrow transplants in that the incidence of rejection, infection is much higher than with other solid organ transplants. And for that reason, we are always looking for donors that have good tissue compatibility with the recipient. In this case, about 50% of the tissue that the two sisters carry in their body is basically identical. And that decreases the risk of rejection, infection, graft versus host disease, and all the complications that we usually see.
We didn't even know of it, this type of surgery, of course.
Yeah.
It was very foreign, and we've learned a lot through it, and it's sensible, it makes sense, and I'm here a week later.
Yeah. When this happened, they told me that, actually they told my husband Eric that to let me go and just pass because I would have a horrible quality of life.
She was still in her coma. We started speaking with some of the teams, the surgeons and the teams here at UMC, just starting to get word that, believe it or not, there's actually a team that's just basically started this exact scenario that we would happen to fit in. We literally looked forward from that point, from that point forward. So 7 months later, it's been a difficult struggle, but obviously we had faith the whole time, and we've come to that point finally today.